probably most people think about clinical trials is, you know, I don't want to be experimented on. I want to get stuff that's already been, you know, thoroughly vetted, thoroughly tested. And if I'm, you know, thinking about clinical trials, like you say, you know, gosh, it means I'm going to, you know, die anytime. And that's why I thought it would be especially good to have this discussion so that I can give you my sense of how I think about this stuff. I do think that, you know, it would be good to be prepared for scenarios where the next change in treatment hopefully will work great, but and hopefully will work for a long time, but being prepared for the possibility that it might not work as long as you'd want, or, you know, and you've been in situations where a treatment that, you know, there was a lot of hope for didn't work at all. And trying to just be ready for those scenarios. And the way that I think about clinical trials is some of the most promising treatments right now come from drugs that are only available in clinical trials.
Interesting.
And you know about CAR T cell treatment, everybody's gaga over that. And I think justifiably, I mean, we've seen amazing responses to CAR T cell therapy. The reason that I'm not as, you know, I wouldn't say go get a CAR T cell treatment right now, because a very common pattern is, you know, shown here, where this is a patient with multiply relapsed myeloma. She's really, this doesn't look, this is her kappa-free light chain. Nothing's working. And she gets a CAR T cell treatment and it just vanishes. The disease just vanishes. And then but then about a year later, it comes back. And this is after, I can tell you, this is after 16 lines of prior therapy where nothing worked. She was never free of disease until after that CAR T cell treatment. So it's the first time she'd ever really been in remission. So it's unbelievable how effective it can be, but the problem with it is from what we can tell, it usually comes back within a year or two after getting the CAR T cell treatment. Now, there's a lot of stuff going on there that I think that will make that much, much more effective, but it's already crazy effective for a lot of people, but just doesn't stick with most patients. So getting back to you, you know, I'm not saying go get evaluated for a CAR T cell treatment. I'm saying now would be, I think, you know, when you're feeling well and you're in pretty good shape, that's a great time to go and figure out what options are out there with respect to clinical trials. CAR T cells being one, but there's this whole other kind of treatment that I have a lot of enthusiasm for called BiTE therapies, which is a bispecific T cell engager, an antibody that will bind the BCMA on your myeloma cells on one hand, and will recruit a T cell to come kill your myeloma cells. We've seen patients have great responses to that treatment. And the problem that I see people get into is they don't start to look at this seriously until they're in deep trouble. And if you're waiting until you're getting sick to survey the landscape, what very often happens is you just run out of time and you lose the window of opportunity. So I think, you know, you right now you're doing okay. I totally agree with, you know, changing things up, and it sounds like, you know, it sounds like your doctor and I are totally in sync on what, you know, what would make sense to go to with the next treatment. But I think, you know, it would make a lot of sense to, again, be in an anticipatory mood, you know, mindset rather than a reactive mindset.